What if the veins bulging in your legs were more than a cosmetic issue? What if they were warning signs of serious circulation problems building silently over time?
Welcome to Dr. Mercola's Cellular Wisdom. Stay informed with quick, easy-to-listen summaries of our latest articles, perfect for when you're on the go. No reading required. Subscribe for free at Mercola.com for the latest health insights.
Hello, and welcome to Dr. Mercola's Cellular Wisdom. I'm Ethan Foster. Today we're unpacking the realities behind varicose veins, a condition affecting over 40 million Americans, and why it deserves more attention than it typically gets. I'm joined by Alara Sky. Together, we'll explore the root causes, early symptoms, treatment options, and practical steps you can take to lower your risk and improve vascular health.
Varicose veins aren't just surface-level concerns. They result from one-way valves in your veins starting to fail. Normally, these valves help push blood upward toward your heart, working against gravity. When they weaken, blood flows backward and pools, increasing pressure that causes your veins to enlarge and twist.
Exactly. These veins often show up on your legs as bluish or purple lines raised above the skin. They may feel warm or tender, especially after long periods of standing or sitting. That's your circulation struggling to do its job efficiently.
The risk factors are wide-ranging: aging, hormonal shifts, pregnancy, obesity, sedentary habits, or standing or sitting too long. Even your genes and connective tissue strength play a role. So if you've got a family history of vein issues or clotting disorders, that matters too.
Pregnancy increases your risk because blood volume goes up, hormone levels shift, and the uterus presses on pelvic veins. All of that adds pressure in your legs, making it harder for blood to return to the heart.
To diagnose varicose veins, a clinician will assess your legs while you're standing. If venous reflux is suspected, a duplex ultrasound is used. This test measures blood flow direction and speed, valve function, and any obstructions.
Over time, untreated varicose veins can become more than uncomfortable. They may lead to complications like superficial vein thrombosis, deep vein thrombosis, venous ulcers, or chronic swelling. These aren't rare outcomes. They're consequences of ignoring subtle signs.
And those early symptoms often go unnoticed. A feeling of heaviness in your legs by the end of the day, dull or cramping pain near the enlarged veins, or persistent swelling in your calves and ankles are all key signs to watch.
It doesn't stop there. The skin over those veins might begin to change, discoloration, dryness, or a leathery texture. That shows your tissues aren't getting enough oxygen. Minor wounds take longer to heal and may turn into ulcers near the ankles.
When symptoms become persistent, that's chronic venous insufficiency. It can lead to fatigue, reduced mobility, and difficulty standing or walking for extended periods. The circulatory dysfunction becomes systemic.
So how do you address varicose veins beyond just masking their appearance? One common first-line treatment is compression therapy. Medical-grade stockings apply graduated pressure to help support your vein walls and push blood upward.
When that's not enough, there are minimally invasive procedures. Sclerotherapy uses chemicals to scar and shut veins. Endovenous thermal ablation uses heat to collapse them. More advanced cases might require vein ligation or surgical removal.
There are also non-invasive alternatives. One of them is dimethyl sulfoxide, or DMSO. It's a naturally occurring substance with anti-inflammatory and circulation-enhancing effects. Applied topically, it penetrates deeply, reducing the visibility and discomfort of varicose veins.
It goes further. DMSO promotes healing in venous ulcers and improves skin integrity where circulation is poor. In studies, it helped regenerate tissue, reduce swelling, and even treat pigmentation and fragility from chronic insufficiency.
Some users report improved vein tone, better blood flow, and fewer signs of inflammation. It appears to normalize blood return and enhance healing, where traditional care has struggled.
Another method is inclined bed therapy. By raising the head of your bed 6 inches, your body lies on a slight incline that uses gravity to assist circulation during sleep. It's a structural approach to enhancing venous return.
This approach mirrors how plants circulate fluids. In human studies, varicose veins disappeared after 4 weeks of inclined sleeping. It's a simple but powerful way to ease pressure in your legs without invasive procedures.
You can also make daily choices that reduce your risk. Moving regularly, especially if your job keeps you seated or standing, is crucial. Flex your ankles, shift positions, and walk throughout the day.
Elevating your legs periodically helps too. Resting with your legs above heart level lets gravity assist blood flow, easing pressure and swelling. Even using pillows or a wedge cushion can make a difference.
What you wear matters. High heels weaken calf muscle contractions, which are key to moving blood. Supportive shoes and avoiding tight clothing around the legs or waist improve circulation.
Managing your weight is another major factor. Less strain on your legs means healthier veins. Consistent walking, swimming, or biking supports vascular tone and reduces venous burden, even without intense workouts.
Ultimately, recognizing the early signs and making proactive changes could prevent years of discomfort and escalating complications. Your veins are communicating important information. Don't ignore them.
Here's your challenge. Today, pay attention to how long you stay in one position. Break it up with a few minutes of movement every hour. And tonight, try elevating your legs or sleeping at a slight incline. These simple changes can shift your circulation more than you realize.
Thank you for watching Dr. Mercola's Cellular Wisdom. We'll see you on the next episode.
Thanks for watching. Subscribe now and click the notification bell so you never miss an update. See you in the next video.